Hi, this is Dr. Douglas Taranow. I'm here to just answer some quick questions about saline implants and silicone implants. One thing you should know right off the bat is that if you're under the age of 22, you're only allowed to be using the saline implants. So anyone 18 to 21 is really limited to saline. However, that being said, they're both very similar. People always ask me which one is safer. If somebody asks me that, I really have to say that the saline is a safer implant. Not that the silicone is not safe, but that the saline, once it's placed, you know if it ever leaks, because as soon as the saline leaks, the breast deflates and you know right away that the implant has to be replaced. The silicone implant, on the other hand, when it leaks, you'll never know. The only way to tell if a silicone implant leaks is really doing an MRI. And unfortunately, a vast majority of insurance companies won't pay for the MRI to detect a leaking implant. My other issues are, whenever you go talk to your plastic surgeon, you should always be able to feel both implants. See which one you like. There's a completely different feel, and everyone feels that they feel differently to them. My personal favorite is a silicone. I feel that it's a little bit thicker, obviously. It, in my opinion, feels a little bit more natural. But the biggest deciding factor on these is the rippling, which is when you're standing up or leaning to the side, can you see the implant through the skin? And the way to describe implants and whether or not they ripple is to hold the implant up. The top half really doesn't seem this way in the body. It's more like this with the pressure. But the bottom edge, especially on the salines, when the pressure hits the bottom of the implant, you can see the rippling on the bottom or the creasing. Whereas in the silicone, if you lift them up and do the same, there is some, but not nearly as bad. And that's really the biggest difference between the implants. Besides the feel is whether or not there's rippling. Can you see and feel the implant? So that's your major concern. One other item to do is to do your homework. The silicone implants were being placed since 2006. So in 2016, we'll have the 10-year follow-up. A lot of people have been doing MRIs to examine the implants to make sure that they're not leaking. Leaking was a major concern many years ago, and since the redesign of the implants, we really feel that the leaking problem is really far behind us. So the longevity of the silicone now, we're hoping, is at least 10 years. And as the years go by, every year after 2006, we'll have more and more documentation on that.